In 1988, 88% of non-smokers showed exposure to secondhand smoke. By 2008, the number was down to 40%, which is really awesome, we think, of course. And basically that's because in the course of those years, states started passing smoke-free workplace laws, and so people weren't smoking at the workplace, and then it got into restaurants, and they could go out socially and not be exposed. So the most dangerous place when it comes to secondhand smoke is in your home. And what we're finding now in the latest data on secondhand smoke exposure is that, as Jill said, that the people most exposed are children between the ages of 3 and 11. They're exposed at about 56%, as opposed to 40% of the general population. And portions of the African American community are being exposed, and these are all non-smokers. We're not talking about smokers being exposed, but these are non-smokers being exposed. So there's a huge disparity now. There are some of us who can go through an entire day and go home and go to bed at night and never smell a cigarette, which is kind of crazy too, because it used to be that you would smell it all the time. But once they took it out of the workplace and took it out of the restaurants, you wouldn't notice it until you actually smelled it. And so we started getting phone calls, you know, the day California implemented their smoke-free bars and casinos law. The day after, on January 2nd, the phone was ringing in my office, and they said, now that you've gotten smoking out of the bars and casinos, you know, can you get it out of my apartment building? And I said, oh man, I was done. But no, I mean, and almost 90% of all our complaints that we get are from smoking in housing. And basically, I could spend 2 hours, multiple phone calls, trying to help one person calling me about smoking in their apartment. Or I could take those 2 hours and go torture a bunch of elected officials. And what we were finding, starting in 2007, was that actually the city of Belmont, California, anybody know where Belmont is? Okay, there you go. Where is it? Right, it's 11 miles south of San Francisco. It's a bedroom community of San Francisco, 26,000 people, median income $100,000 a year. Belmont, California, the city council was listening to a bunch of senior citizens talking about the smoke in their housing, and they were hearing what their health histories are, and they were seeing these elderly people come in their wheelchairs with their canes, begging them to help them, because here was the last place they really intended to live before they went out feet first or went to a nursing home. This is the last independent living opportunity. And yet they would wake up in the middle of the night smelling smoke because the neighbor was smoking. So basically in Belmont, they decided that night that they were going to ban smoking in the whole city. And I've been working in smoke-free housing, general smoke-free laws for 16 years at that time, and no one was expecting that city council would just jump off this cliff, you know. And, you know, we thought they would take some mild-mannered approach, and you know, I'd have to stand up and talk about secondhand smoke, but you know, 24 senior citizens coming in and talking about their plight just pushed them over the edge. They were asking me if it was legal to ban smoking in housing, and I said, yeah, it is legal, and I said, oh shit. You know, this is not like I want to do stuff and yeah, I can just mark this right here and I did it, you know. I knew that it was going to be a lot of work, you know. And that was in 2007, and in by 2009, 2 other cities had joined them. And one city was Richmond, California. Do you know Richmond? Nobody knows Richmond? 100,000 people, predominantly African American, low income, was formed during World War II to build the ships. So Richmond was a much different community than Belmont. And so basically we rolled up our sleeves and said, you guys pass this law, we'll come in and help you. But along the way I've been helping a lot of property managers like yourself, and basically y'all don't need much help. All you need is the green light, and all you need to know is what I'm going to run through right now. Okay, so it's not in my bedroom, hopefully not in your bedroom. Okay, so anybody ever seen a wall like that? Ever had to clean a well like that, a house like that? This is a smoked-in apartment where a single woman lived, public housing for many years, was disabled, and just smoked and smoked and smoked. And this is how her walls looked. Okay, so the reasons for going smoke-free were you save money on maintenance, cost of rehabbing units, a non-smoking unit. These are all relative numbers. These numbers are taken from a survey of Maine property managers. So they were trying to see what the differential in cost was. So in Maine, and I know Hawaii dollars are a lot more, or a lot less, whatever it means. But anyway, in Maine, a non-smoking unit, if it costs $560 after someone moved out to clean, a light smoking would cost $1,800 and a heavy smoking would cost $3,500. So you just factor that into the percentages that you see here. They did an extensive survey of the California Apartment Association landlords, members, and they specifically focused on the smaller, not the big landlords and not the real itty-bitty ones, but the middle ones. And this is what they were telling us, that more than 25% of their apartments had smoking-related costs, and the average multi-unit housing property turnover cost was nearly $5,000. And for the people who converted their buildings to completely non-smoking, they cut their turnover costs and maintenance costs in half. So the demand for smoke-free housing is really great. In 2006, I was looking at the data from Hawaii, is that 86% of households, Hawaii households, did not allow smoking inside, 86%. There's a reduced, you want to look at reduced fire risk. Whenever you do, anybody ever have to experience a fire in any of the buildings you manage? You know, I've met people who are still like completely traumatized just going through helping people after that fire, you know, and you're nodding over here. That's exactly what happens. I mean, basically, we're looking at the fire data from the National Fire Safety Institute. And basically, whenever there's a careless smoking caused fire, they're finding that 25% of the victims are not the person who smoked. They're residents of that home and also the neighbors. Elderly are most at risk because their sense of smell isn't so good, so they're not going to smell it as soon as a younger person might. Also, they're not as mobile as a younger person. So 1/3 of all smoking-related fire victims are the elderly. And, you know, we know that as we age, different parts of our body go under. So, you know, those things slow us down too. And they're less mobile, they're sometimes trapped in the smoking homes. And here's something I discovered along the way, is that people who are on oxygen, you know, with the tube and everything, actually everything around their body is oxygenated because the extra oxygen molecules are attached to their hair and their clothes. So, you know, if they come near a flammable source, they will go up a lot faster than any of you who are not covered in oxygen molecules. So, and of course the terrible irony is that people on oxygen, many of them are very severely addicted to nicotine. So they might be still smoking and using oxygen at the same time. And I've talked to a property manager who, you know, she went in to visit this old lady who's being taken care of by her son, who was disabled, slightly disabled because well, not slightly, he was disabled too by his smoking. He lived with his mom in an elderly apartment. And she was visiting with them, and then he said he needed a smoke. And she says, well, you better go out, you know, on the patio and smoke and detach from your oxygen. He says, yeah, right? And she left, she got in her car, and she heard an explosion. Because basically, and then he lit up, and he exploded. I mean, he didn't explode. Well, yeah. The oxygen exploded, he passed away, and there was no one to help take care of his mother. So, I know in California and in these states, and I'm sure you guys can pull this deal with your insurers, is that insurers more and more are, when you negotiate with your insurers, which I know you do all the time, if you have a converted smoke-free building, we know in California, and for CIG, and this isn't an ad for CIG, it's just that they made this a big deal, so I'm just saying, okay, you made a big deal, we'll talk about you. They're offering a 10% discount if you can show that you have a smoke-free building. And so if you use that to leverage your own carrier, you say, well, you know, I know CIG doesn't cover you guys, but just fake it. You know, you just say, you know, I've heard we can get a good deal on this, you know, let's negotiate a better amount for our insurance. So 85% of adults in Hawaii do not smoke, and 86% of Hawaii households do not allow smoking in their homes. You add it up. You go smoke-free, you save money on maintenance, you reduce turnovers and the cost in time and money in turnover. I mean, it takes 2 or 3 extra days to turn over a smoked-in unit because you have to put in that special primer to seal in the stuff in the walls. I've talked to people who had to rip out their walls because the smoke permeated the entire wall. Reduce fire risk, discount on insurance, and there's increased public demand. What we're seeing in California is that what's happening is landlords and property managers who do not even enforce the local laws about smoking in common areas are finding a shift in the kind of prospective tenants who are coming to check out their building. What we're finding is that even with the law, Hawaii's law of no smoking in common indoor areas, if you vigorously enforce it, like saying, you know, Mrs. Wong, you know, I know you used to want to smoke on your way to get your mail in the mailbox, you know, but that's in the hallway. So you can't do that anymore. So basically, the forward-thinking property managers and owners would start enforcing the common indoor area law the way it's supposed to be. And what happens is the people who smoke either learn just to smoke in their unit, or they say, oh, I want to go and live with my friend Joey, you know, he's over there at that apartment complex, and nobody tells them not to go smoke in the hallway, even though it's a state law. So what I was finding was I was doing trainings for Section 8 landlords, and they were telling me that they were finding that a higher percentage of tenants, prospective tenants who were coming to look for units in their building were now people who smoked. How much higher than what the county average is. In Alameda County, where I'm from, which is about the same number of people as Hawaii, but it's more spread out, Alameda County, the smoking rate is now 10%, because we've passed all these laws and people are very aware of the laws, and they've come to expect that there should be a law, and these things are going really fast. So basically, what we're seeing is that buildings are becoming lopsided. The landlords who are just enforcing the plain law of no common indoor areas are either getting the people who smoke in there to be more considerate, or the people who smoke are being attracted to other buildings. And when you don't pay attention, your building will be filled with a higher percentage of people who smoke than other buildings. And we know in California that cities are now very prone to pass smoke-free housing laws citywide. So right now, I can't remember how many, but it'll come to it. Right now, about 1.5 million people in California live in cities that have banned smoking in all multi-unit housing. So that's about the number of people here in Hawaii. So basically, when a city passes a law, then you're under the law to say your building should go smoke-free within this time frame. But if your building has become a magnet for people who smoke and who expect the right to smoke, then you're going to have a much harder problem then than you will like right now. Like if today, before you guys leave, you say, wow, every new lease I sign is going to be a smoke-free lease, you know, and as people turn over, by the time the city or the county or the state passes a law, you guys will say, that's cool, you know, no problem. But if you sit around right now and say, well, you know, we should let people smoke, it should be okay, when the law passes, or when people start getting this idea of suing and doing these wacky things, you're going to be in another situation. So also, there's a big green movement back on the mainland. I'm assuming there is one here. You know, you go to all this trouble to remove formaldehyde and all of these toxins from your new building materials. Secondhand smoke has formaldehyde in it. secondhand smoke has lead in it. At UCSF, University of California, San Francisco Hospital, they were testing children there for lead, how much lead was in their blood, and they decided to test for secondhand smoke too. And they were realizing that the children exposed to secondhand smoke had a higher lead in their blood than children who were just in a house with lead paint. I know that sounds crazy. No, but it doesn't. There's lead in secondhand smoke. So it's crazy to clean up your buildings and use only green materials and then let people smoke in it. This is just the commercial about how bad it is. You all know, right? 7,000 chemicals, 70 can cause cancer. Toxic metals, poison gases, ammonia. Interesting thing about ammonia, a long time ago when they first invented common commercial cigarettes, they were all kind of equal in competition, and then suddenly Marlboros went up, boom, went up. Sales Marlboros beat up all the other brands, and so the other competitors broke up the cigarettes and trying to find out what the secret ingredient was, and the ingredient is ammonia. And basically when you add ammonia to a cigarette, it freebases the nicotine straight to the brain. So people who smoke Marlboros were getting the nicotine straight to their brain right away. And then when people smoke, they want to get the hit faster and faster, right? So basically, everybody started adding ammonia. So ammonia is in all commercial cigarettes. So people talk about, well, what is secondhand smoke? It's a gas and a vapor. There's a gas that can be absorbed into the walls, carpets, and clothing, and then there's the smoke particles that you can actually see. It's the stuff you saw on the walls. Those are the actual particles. And those particles, how small are they? You know, the width of your hair, 80 particles can be in the width of your hair. So secondhand smoke particles are really, really, really small. And they're so small that when you inhale them, your body doesn't have the protective mechanism that it has when you inhale a larger particle. And so if I were to have an old-fashioned, do you remember the erasers for chalkboards? Those dust things, and then you raise your hand and the teacher lets you clean it? Well, if I were to do this with the dust particles, everyone in the front row would sneeze and cough and then come and kill me, right? So those are pretty large particles, and your body reacts immediately. But with secondhand smoke, some of the particles are so small, your body doesn't even know they've come in, and they just come right in, and some land directly into your bloodstream. So basically, there was a study at UC San Francisco where they had healthy male college students who did not smoke and signed an agreement not to be exposed to any known air pollutions for 24 hours, and they were tested. They put them in a air testing chamber, and they literally put a big plastic bag over their heads, and they exposed them to what is equivalent to half an hour of secondhand smoke. So if you were sitting out on the patio over here with your best friend or your auntie so-and-so who smokes for half an hour, that was the amount of secondhand smoke these young men were exposed to. And then every so many hours they came back and did a blood draw to see how, I call it the viscosity of the blood, but I'm sure that I'm thinking about cars and not people. But what happens is when secondhand smoke enters your bloodstream, your blood tends to thicken and react to it. So your blood flow is less good, huh? So anyway, so basically they tested these young men for 24 hours. So when do you think their blood returned to normal?
43 days later.
Well, what happened was I actually sit on the research panel because, you know, I'm nosy. And so the researchers were reporting back to us. And so they said, well, after 24 hours, their blood was still not back to normal. Like half an hour of exposure to secondhand smoke, and their blood is not back to normal. It's still thicker. So that's why heart attacks and strokes are very common among people who are exposed to secondhand smoke. Because what happens is your blood is thickened, and if you blow a clot, if you have any other blood flow issues, then you're totally prone to have a heart attack or a stroke within that 24 hours after that exposure. So this is not a little thing. It's not like cancer in 20 years. This is a heart attack within 20 minutes. of exposure. So they did that study, and so I asked the researchers, we said, well, if it didn't clear up after 24 hours, how long did it take? And they looked at us and said, well, how do we know? You wouldn't pay us for the rest of the study. They wanted to do 48, but we only paid them to pay the subjects for 24, so that's what we did. Ever heard of third-hand smoke? Huh? Yes? No? Like if I were smoking in here, you all would be breathing second-hand smoke, right? But if someone had been smoking in here and left, we were all being exposed to third-hand smoke. Because basically the smoke expands and it gets absorbed into everything in this room, especially the fuzzy things. So you have the carpet, the walls, the ceiling, and if there's enough smoke, you know, it'll get absorbed into the wood and everything like that. So the 3 R's are residual pollutants that remain on surfaces and dust after the smoke, re-emission of tobacco smoke pollutants back into the gas phase. So I think about, you know, accordions, the Lady of Spain. I was once in a hotel with an accordion convention. And I'd wake up in the middle of the night hearing the Lady of Spain going up and down the hallway. It was awful. But I think about how accordions move, right? And that's how vapors move. So they move out, and then they come in, and they come out. So basically, if someone smoked in here and then left, the smoke would be absorbed into the walls and floors and carpeting and chairs. And then after so many minutes, depending on what chemical compound it was, it would come out again. So it would come out and interact with whatever came into that room next. And then it would expand again back into the walls. And, you know, it goes into the walls, but when it comes back out, it pulls out whatever was in the wall, too. So I call it the Frankenstein brew. I mean, basically, I was talking to somebody who does titles. You know, when you sell a place and someone goes in and gets you to sign everything and initial it 50,000 times. So they go to your house and they sign a thing. So you could go to somebody's house to get stuff signed. That could be a house where people smoke, but they aren't smoking when you're there. But when you're sitting there for half an hour, you are absorbing the third-hand smoke into your hair, skin, and clothing. And then you go home and your grandkids or your kids are playing with Play-Doh. You ever smell Play-Doh? Or whatever home improvement project is going on. So basically, you are kind of like a walking, desorbing creature. And when you come in contact with other chemicals in wherever you've gone next, they mix too. So there's all kinds of weird things that are happening. So the reactions between tobacco and other smoke pollutants can yield other pollutants. And most recently, they did a study on third-hand smoke, which is, like I said, these 3 R's, but they took tobacco smoke and they interacted it with ozone, which is prevalent in almost every single home as a normal household pollutant. And what they came up with was some cancer-causing dust that exists only from that mixture. And they took that dust and they exposed it to human cells in the human cell studies to see, because you know, not a whole lot of people are going to say, yeah, let me add it, right, in an experimental state. But in a controlled environment, they were seeing that the human cells were being damaged and that DNA was changing within the cells. So again, you know, in homes, earlier the Berkeley lab, which is the same lab that did the recent study, they did find that the little dust particles that form when you have secondhand smoke exposed to ozone, which is a common household pollutant, you have these tiny cancer-causing dust particles. And the people most likely to get a hold of those are, of course, children who stick their hands on everything and then they stick them in their mouths. The other thing is a lot of hotels here, you know, they say, oh, $200 fine if you smoke in your room, right? And then if you do, what do? They roll in an ozone generator. Because the ozone generator gets rid of the smell. It doesn't get rid of the poison. But people aren't measuring for poison. They're measuring their subsequent customers, you know, saying, oh, this room stinks, give me another room, right? That's what they're measuring, right? So they use an ozone generator. But now they're realizing through this research at the Berkeley labs is that the ozone generator is what generating ozone. The ozone might cancel out the smell that your customers or clients complain about, but it's actually creating a cancer-causing dust. So, again, green equals smoke-free. Secondhand smoke is a major source of indoor air pollution. And so in your apartment, as much as 65% of the air in your apartment is from your neighbor. 65%, because of the air transfer. You know, none of us live in bubbles, airtight bubbles. And of course, we know that secondhand smoke can cause asthma and aggravate existing conditions. So this is a study made in a high-rise apartment building where the fourth floor tenant was complaining about smoke in his unit. And I'm just going to rush through this, but they basically use scientific measurement tools. And when did they do it? They measured this in the middle of the night, because the people would come home and they would smoke in the middle of the night. And this man with his 2 teenage daughters was complaining that he could not stay in his apartment. So if you look here, what they did was measure the levels of secondhand smoke or pollutants in the parking garage to prove that no diesel truck was polluting the building. This study started at 12:20 a.m. So in the course of 140 minutes, you see that the first red bars is the hallway outside the third floor unit. And then they ran back down to the lobby to show that it wasn't coming from the lobby. You know, they're doing scientific measurements. And then they went to the second floor unit, outside the second floor unit. Again, you see the smoke was just gushing out under the door of the second floor unit. I mean, these people did not let the researchers in their apartments. They were just out the door measuring the pollutants. Again, back to the parking garage. Again, still no monsters spewing out smoke. So they wanted to demonstrate it wasn't smoke from any other source. So if you look at after about 110 minutes, inside the bedroom of the fourth floor unit of the complaining tenant, it had gone off this chart here at the top. And so basically this big fat bar here is the fourth floor tenant who did not smoke. And this is the level of smoke in his apartment after 140 minutes. And that's in the middle of the night. So you say, well, what does that mean? Well, the numbers mean that you saw that spike. That is the level of particle matter in his apartment reached unhealthy levels according to the EPA outdoor air quality standards. So when the EPA, I don't know, do you guys ever have like warnings about air quality in Hawaii? Because you have all the winds, right? But in other places where you don't, or maybe in the valleys. So back on the mainland, if someone says, they do a warning, they say, the air is unhealthy, that red bar, people are told, don't go outside, don't go out and run around the track and do a, marathon or whatever. And then further lower is unhealthy for sensitive groups. So anybody with any kind of lung. So what we're saying is the air quality in the fourth floor apartment exceeded the EPA's outdoor air quality standards. And no one smoked in there, and it was just the second and third floor units. So it can trigger asthma, lung infections. The elevated pollution levels found in the units were for up to 8 to 24 hours a day, and they exceeded the Environmental Protection Agency standards. According to the Surgeon General, there's no risk-free exposure, and all ventilation systems are designed to spread the air and share the air. So if you can smell, if you know when your neighbor is making bacon, then you're sharing air with your neighbor. And even if you don't smell the secondhand smoke, it doesn't mean that you're not being exposed to it. Because we know that the ozone generators take away the smell, but they don't take away the poison. And in California, the California EPA has declared secondhand smoke to be a toxic air contaminant, which is at the highest level of toxicity. So legal issues. Our landlords caught between a rock and a hard place. Smoking is not protected under the Constitution. Smokers are not a protected class. Banning smoking on the property is no different than a prohibition of pets, excessive noise, or other nuisance behavior. Lawsuits. Am I going to be sued if I turn my building smoke-free? Well, there have been the public housing authorities, of which there are about 240 that have prohibited smoking in housing so far in the United States. There have been no legal challenges. There have been a number of lawsuits brought on by tenants saying they're exposed to secondhand smoke, and the landlords have been held responsible for that exposure. Even though you didn't do the exposing, you were allowing that exposure to occur. So these are 3 cases, and there are more cases. Can you be held liable? Well, nuisance and right of private enjoyment is an issue. You have a requirement as a property manager to abate nuisances and to prevent nuisances. I know you're not Superman or Superwoman, but that's under what is required of property management. Warranty of habitability. You know, that gentleman with the 2 daughters did not have a warranty of habitability if he couldn't even live in his own unit that he was paying rent for. Claim of injury or death. You know, Lord forbid either the daughters had asthma or any other condition. Failure to make a reasonable accommodation. And some people are doing now is when the landlord or the manager doesn't listen to them after they've complained and they completed a whole dossier and they don't want to fight anymore, they can always move, right? So they move and then they turn around and they sue the landlords for constructive eviction. Can you be held liable? Like, in some insurance, you know, if you read the fine print of your insurance policy, I don't know if you want to do that, but in there, the standard policy language says there's a pollution exclusion. In other words, if somebody sues you and it was pollution that caused their injury, your carrier might look at the fine print and say, we're not going to cover you on that. And acts of discrimination, illegal activity exclusion. So, you know, you're not in a really, you are between a rock and a hard place sometimes when you have to deal with this issue. Smoking is not a disability under federal or state law. And in fact, prohibiting smoking can protect against lawsuits by the tenants with disabilities who might come after you for any problem they incur as a result of their neighbor smoking. Landlord disclosure. Oregon and the states of Oregon and Maine and the cities of Duluth and Buffalo, New York, have all passed laws requiring landlord disclosure, which require landlords to disclose to all prospective tenants what the smoking prevalence is in their building. The city of, I forgot, the city that I helped get it passed first, Oakland, has landlord disclosure. And what we found is that when landlords, in order to do landlord disclosure, you had to find out what the prevalence of smoking was in your building to begin with. So they surveyed the tenants in Oakland, and they found out that most of their tenants did not smoke, and most were willing to voluntarily sign a new lease, a smoke-free lease addendum. So what we're finding in the city of Oakland, and this is just anecdotal because we haven't had the research money to go actually do a huge survey of the landlords, but whenever we do random sample of landlords, we're finding that a lot of them have converted their buildings to non-smoking. Because by doing disclosure, you had to find out what it was in the first place, you know, how many people are smoking in there. And then if you just simply start issuing all new initiated leases as non-smoking and asking the non-smokers in your building to convert, you might be at 80 or 90% just like that. I mean, if those stats on Hawaii, about 86% of people in Hawaii prefer non-smoking units, then, you know, if you have a standard building with the standard population in it, it might be 85% non-smoking already. Nuisance. The state of Utah considers secondhand smoke to be a nuisance in housing. And many California cities and also San Francisco and New York City are considering landlord disclosure. And in California, we have 14 cities and county jurisdictions that have completely banned smoking in all multi-unit housing. So that encompasses about 1.4 million. So these are the steps I was just muttering about. Find out what, you don't have to do anything. You just want to find out what your situation is. You want to find out what is the smoking prevalence in your building. And then based on that data, you can decide, wow, I could go smoke-free. I just have to get rid of Joe. You know, I'm not telling you this, but I'm just saying. You might just find out that there's only one tenant who is smoking, and you never really realized it. You might realize that some of the other tenants you thought were smokers were not because they had relatives who come over and smoke. But, you know, if you adopt a policy saying it's for the entire building, and you just say to Joe, you know, I'm going to be doing this. I'm not against smokers. I'm just against the smoke. Let's figure out a place where you can't smoke. you know, you have a done deal. Every time I talk with people who've already done it, they say the worst part was talking about it. You know, after we said we were going to do it and we followed the steps, it was so easy, they spent the rest of their time hitting themselves over the head, wondering why they waited so long. That's what they all tell me. I said, really? Yeah. So, yeah, all new leases, lease renewals, adoption and dissemination of new house rules, having everybody sign it so they can't say they didn't know. Communication with staff and tenants, ample warning, group meetings, one-on-one if needed, ample and clear signage. Clearly written complaint procedures. You know, if you decide to enforce your law, your rules against one tenant and not the other tenant, people are not going to appreciate it. They're going to charge discrimination. You have to be consistent across the board. And staff, you know, they're the front line. They're the people who will see the smoking. They're the people who have the relationship with the tenants. They have to be on board with this. And tenants have to know how to file a complaint with you. They understand what will happen when a complaint is filed, prompt and fair enforcement. In all the places, like City of Richmond, which has a very high, low-income population, their law has been in effect for 2 years now. There have been no evictions. You know, they have designated a set of code enforcement officers who go and knock on the door and talk. And it's all about talking with the tenant, talking with the manager, like, hey, dude, you don't have signs up, you know. And the landlord has to show the smoke-free lease. But the thing is that when people know what the enforcement protocol is, and you follow it a few times, you know, word gets around, and then people understand that's what's going to happen. Early adopters are finding high interest and higher demand for their units, and longer waiting lists. I had a public housing, affordable housing project. They were smoke-free. They opened up their lists. In 24 hours, which was the amount of time they opened up their waiting list, they had 2,000 people on that list. The place across the street was having trouble filling their units because they didn't have any smoke-free policy. So the demand is far higher than the product that is available. You're going to have cleaner units, lower maintenance, happier residents. You won't have us bugging you. Healthier residents. They have to find something else to complain about, right? So the non-policy adopters are likely to find a concentration of tenants who are highly addicted to tobacco use and committed to using it. Non-smoking tenants moving out because, you know, they're going to be drawn away to the cleaner buildings, increased fire risk, and increased maintenance and repair and replacement costs. So right now the choice is yours. Smoke-free buildings will attract guaranteed 87% of the pool of renters in Hawaii right now. If you allow smoking, I mean, once people start advertising that they're smoke-free, they're going to suck away people from your waiting list. We found that happening in Colorado Springs, where one senior complex went smoke-free, and their waiting list went up, and her competitors, they're all affordable housing senior buildings, but her competitors were seeing that not only were they losing people from their waiting list, they were losing people from their buildings because they wanted to move out and go into the smoke-free building. So she agreed to do a training for her fellow property managers on how to do the same thing. So we can help, and we, I mean the royal we. Jill's here. I'm still in California. But everyone has access to all of the best knowledge that we've acquired over the years from all the other states, from property managers just like yourself, because we always rely on you to tell us what we're saying or writing about or putting together. It really follows what is your reality. You know, we are just like health freaks, right? You guys do the day-to-day work of managing property and managing people. And we've learned so much from you as to how to make this thing happen.